Good morning, everyone. My name is Michael McCoy. I'm with HITECH Associates, and I will be helping you navigate the new HIPAA laws, including information blocking, and going through what your practice needs to do to get ready as things are going to change. I have with me today Joseph McCoy. He's been with us for 3 years, graduated at the University of Florida, and he's going to be doing a good part of the presentation today as well. Many of you that are our clients have gotten to know them. And for those of you that aren't our clients, we look forward to talking with you in the future if you have any HIPAA concerns that we can help you with. So starting off today, I want to talk about enforcement, because when it comes to these rules and regulations, enforcement is kind of secondary. We really want to protect patient privacy, but I want you to know that enforcement is going to increase. It's currently being done by the Office for Civil Rights, or OCR, and the Office for Civil Rights has expanded now because they are getting increased complaints. But we'll also have coordination with the Office of the National Coordinator. They are the ones that are actually doing the rules for information blocking. They are a guidance type agency, and any enforcement will actually go to the Office of the Inspector General or the OIG. These are very serious agents. They tend to look and be scarier than even FBI agents, as I've read in some commentaries. And they are the ones that are going to enforce information blocking, which will have severe fines and could also carry Medicare and Medicaid fraud. So information blocking is serious. We've also seen increase in the Federal Trade Commission, the FTC, getting involved with HIPAA violations, especially breaches, and also something new. We're not going to touch on that today, but I strongly encourage you to kind of monitor, because we are going to have a webinar probably in a week or two on the new requirements for your website. The Federal Trade Commission has been very active in making sure that your website is now also HIPAA compliant. So when it comes to enforcement under the HIPAA and information blocking laws, they have a method of each violation is a separate fine. So you could have one violation or one circumstance that is many violations, so that the violations can add up. Also, each day is a separate fine. So when you hear these multi-million-dollar fines, it's because they've added on for the number of days that they were out of, the reason that they were being fined. And now, for the small practice, the average fine is about $60,000. Of course, if you're a larger practice, you're going to get an even higher fine. They've also have what they call a corrective action plan. And the corrective action plan is really where they monitor your activities. It used to be for 1 year, now it's for 2 years. So a good example, in the information that Joe's going to go over, any violations of that access or information blocking could get you monitored for 2 years, and every 90 days you have to submit what records have been requested and how you handled all of those. So again, something that could be a lot of work for your practice as well. So OCR has been receiving a ton of complaints. They have doubled in the last 2 years, from about 26,000 a year to 51,000. They take great pride in addressing each and every one of these complaints, and to do so, they have now announced a new enforcement division dedicated solely to reviewing those complaints, which means auditing and investigating your practices. All it takes is one patient complaint, and you are now on their radar, and you're going to be getting lots of document requests. So that's one of the things we're going to focus on today is documentation. Website enforcement, again, not a topic of our webinar today, but I want to warn you, your website is causing a breach, and it is going to be a top priority of not only the Office for Civil Rights, but the Federal Trade Commission can come after you as well. So when we talk about HIPAA, one of the things we have to talk about is what is called willful neglect. It is actual part of the law. And I want to tell you what not to tell an auditor if they're investigating you, because these are defined, and this was done by Ileana Peters, the former director of the OCR, She was there for over a decade. And saying these things finds you in willful neglect, which means your fines get enhanced. So not saying that this is not important. It wasn't important for us to get antivirus because we have Windows Defender and we didn't need anything else. Not important. That could be willful neglect. Not spending the resources. Well, we didn't want to buy that firewall because it was $1,200. That would be willful neglect. Or the doctor doesn't agree with that part of the law. That also is willful neglect that we want to avoid. So I do want to also point out that there's still a couple of days left here, that the Office for Civil Rights is proposing a new rule on reproductive health information. And if you would like to read that and comment on it, this slide has that information. By the way, we will be making all of the slides decks that we have showing you today available at the end of the presentation. So here's something that I think we can all agree with. Nobody knows how to release medical records. It's just very frustrating as a patient. So let's not talk as your office now, but as a patient, when you go to your office, I know even though the doctors I go to know I am a HIPAA specialist, they still violate HIPAA in giving me my own records. So the question is, do I turn them in? And so you're probably going to run into that as well, because as you learn what your rights are as a patient, there's going to be a temptation that if you can't get your records in a timely manner and for these new pricing that we're going to go over, that you're going to get, you might want to turn them in. But again, if you do, it's going to be a top priority for the OCR and they could get into a lot of trouble. So our goal and what Joe's going to teach you today is how to make sure that your patients don't get into that situation where they have to determine, do I turn my doctor in because they are not following the HIPAA rules and regulations. So Joe, I appreciate you being here with us today, and I'm going to turn the presentation over to you so that you can explain to our participants exactly what they need to do to make sure that they do not turn into an information blocker. So are you ready with your screen?
I am. I'm ready once you make me a presenter.
And we are there.
All right, is it up?
Yes.
Okay.
Oh,
all right,
wait.
thank you.
Let me see here. I just trying to look at the view here and make sure that everybody can see your screen. Yes, they can. Okay, we're good to go, Joe.
Okay, thank you very much for that intro. And like you said, what I'm going to be talking about is the new, or it's not new, but information blocking and the HIPAA right of access to make it clear to you so that you can make it clear to your patients how to properly release medical records. As we've said, this has become a major point of emphasis for enforcement from the Office for Civil Rights and other participating agencies. So just as an example, this is a quote that comes from a former OCR director, and this explains perfectly what the government's attitude is towards releasing medical records. It should not take a federal investigation, which is an OCR audit, which you could be liable to in the case of a mishap, before a HIPAA-covered entity provides patients with access to their medical records. So a lot of the what we're going to be going over is using information directly from the Office for Civil Rights, particularly the HIPAA Right of Access Initiative from 2019, as well as the implementation of information blocking, which was technically made effective on April 5th, 2 years ago. However, we have now finally entered final regulatory period, and enforcement of information blocking is upon us. To further accentuate how much the government is going after violations of right of access, this was a bulletin that was posted that explained that they did an 11 cases at once enforcement for violations of the HIPAA right of access. And just for context, this is an unprecedented amount of enforcement in one go. So as much as we've been talking about, it's really emphasizing that this is where the government is ramping up enforcement. and that even for a small practice, the average fine is $60,000 for violating these patients' rights. So what we're really going to be focusing on when it comes to these requests for records are the 5 most common types, and that is patient requesting their own records, patients requesting that it goes to a third party, that we understand how to deal with subpoenas or from both the patient's attorney and from the opposing attorney, how do we respond, and then also when another provider requests records for continuity of care purposes. Here's a diagram that was created by the Health and Human Services Department, and it clearly illustrates all of the different ways in which patients can request records, our duties in order to make sure that we authorize it properly and then fulfill those records in whatever format that they have chosen. So it really emphasizes that the patients have all rights in order how they can request records and how we have to fulfill them. It's also important to understand that patients have the right to what is called the designated record set, which in simple layman terms is everything that you have on a patient. It doesn't matter how old it is. It does not matter if you generated it yourself. If you maintain those records on a patient, then those patients have the right to those records, with a few very specific exceptions. Now, the big change that is going to be coming with information blocking to how patients receive their medical records will be through the patient portal. Now, this is a way for patients to immediately access their medical records. This will require you to make sure that you are uploading not just all of the information that you have on a patient to the portal, but that you are uploading all of this information proactively, even before a physician can sign off on it. And you might be thinking, well, that sounds a little counterintuitive. Do patients even want to know, lab results or anything like that, before a doctor can review it and make sure that they go over it with them? Well, a study by the JAMA of over 8,000 patients universally at 96% decided that patients want their medical records as fast as possible. So the patients want their records as fast as possible. The government wants you to give the records to the patients as fast as possible. So you have to abide by this. So now we'll talk about what are the general rights that patients have when they are requesting their medical records. So as an office, we are allowed to require a written request as long as the patient, or unless the patient says that it would create a barrier or cause an unreasonable delay. The patient has the right to request expedited delivery of their medical records if they don't want to go through the full authorization process. Now, in the case in which a patient exercises their right to deny a written request, then we have to have a process to verify their identity and take reasonable steps. So we wouldn't want to do anything that would be considered unreasonable. And the important part of this process is that we document that we verified their identity to make sure that we are keep from being liable. Now, when we are requiring a written request, we cannot create an unreasonable measure that impedes access to PHI. So an example of this would be requiring a notary, only accepting paper submissions, anything that would make the patient have to go up and out of their way to get their medical records. It's really about easing the process from getting the patient getting their medical records from their providers. Now we'll talk about the different forms and formats that patients can receive their medical records in, and it comes down to anything that is considered easily and readily producible. And it's important to note that if a patient makes a request for records and they want it in a specific format and it is considered easily producible, you could suggest, hey, maybe it's easier to do it this way, maybe it'd be cheaper to do it that way. But it really comes down to the patient's decision on how they want their medical records, and they have the rights to that. So aside from format, another important component to getting medical records to our patients properly is doing it within our time standards. So HIPAA, which is referring to paper records, says that we have a 30-day allowable to get our medical records to our patients. However, that should be treated as an outer limit, and we should really be trying to do it as fast as or as soon as possible. Now, information blocking plays with this time frame quite a bit. It's important to remember that information blocking only applies to electronic health information, or EHI. So everything that you have on the computer, anything that's being sent digitally. So information blocking changes it and gives you no specific time frame and says that you are required to share those records immediately or within a reasonable time frame. So when it comes to electronic records, now that we can send them with the push of a button, we have to accommodate the new technological capabilities. Now, there is a HIPAA proposed rule out there that would even change the 30-day allowable to just 15 days, and it will also bring changes to stat requests that we would now have to fill out stat requests as fast as we possibly can. The last component to making sure that we get our patients their medical records properly is to charge them appropriately. We have seen that the OCR likes to enforce if you overcharge for medical records. So they have established that you can charge up to a flat fee of $6.50. Now, if we are going to charge anything over $6.50, we have to use some sort of documentation to prove how we came up with that number and use a reasonable at cost formula for how we came up with that price. Because the whole point is that we are not allowed to profit off of giving our medical records to our patients. So if we are charging anything over the $6.50, we have to have proof. Now, if you reside in a state where you can charge, say, $10 or anything over $6.50 as your state allowable, you are actually required to follow the federal law because it is cheaper to the patient. So in that case, the state law would not apply. One thing that we've really emphasized recently is distinguishing the difference between an access request and an authorization request. Medical records departments can have confusion with this, as well as the patients themselves not understanding the differences between these processes. So what it really comes down to is who initiates the request. So a right or an access request is when the patient is requesting their own records or requesting their own records and sending it to a third party. An authorization request is when a third party or continuity of care, somebody else is requesting the records on behalf of the patient. So the first thing to go over is what is properly in an access request. So in order for a proper access request, we have to have the patient information, we have to have what records are going to be sent, and the signature of the patient. So it's important that, or not just the signature, or in lieu of a signature, if they choose that they just want to be verified instead, then that we did our verification. So those are the only things that are required to be on the access request form, but the one that we have created makes it a bit more easy to comprehend on behalf of the medical records department, as well as the patients, to ease any confusion. So we have instructions specifically to, what is the actual information that's being released to make it easier to understand on both sides. So this is our authorization form, and the important parts about the authorization form is that we have all 9 required elements. If there is even just one element that is missing from an authorization form, it is considered an invalid authorization, and disclosing those records would be considered now a breach because it was not sent with a valid authorization. Other important parts of the authorization form is making sure that if we are dealing with any kind of SPHI or sensitive protected health information, that we are having a second signature to authorize the disclosure of those records. And it's important to note that there's been additions to the SPHI definition, including reproductive health information, which also includes things like birth control medication, miscarriages, and has really broadened the definition of what is considered reproductive health. Now, if you are a office that deals with any kind of substance abuse disorder or disclosures, any information involving substance use treatment, then there are even more specific regulations and components to that authorization form. So what we have done is we have created a quick guide that goes over the top 5 most common requests for medical records and what to do depending on who is requesting those records. So when a patient is requesting their own records, we have to make sure that we give them an access form. The big difference is that with access forms is that if the patient is requesting their own records, or if the patient is requesting that their records get sent to somebody else, it doesn't matter where it's being sent, it matters who is requesting those records. And if it's the patient themselves, then we would use the access form, and that we would have to make sure that we verify their identity and that we know the timeliness and the fees that are associated with that. And as we can see, when we're doing a patient request to a third party, we follow the exact same process. The differences shift when we get to provider or a continuity of care request. So when a third party is requesting a patient's medical records, we do not use the access form, and instead we use the authorization form. So unfortunately, when it comes to dealing with authorizations coming from third parties, it is your responsibility to make sure that you verify that it is a proper authorization. Like I said, if you go through and don't check it and there were errors in that authorization form and you disclose those records, you are at fault. So on the very right of the screen, the valid authorization checklist, this is a form that was specifically created by the Office for Civil Rights as a checklist to make sure that any authorization that you receive is made sure to have all of the required elements. So responding to subpoenas is also a very confusing part of HIPAA, so we've made that a lot more clear. And what we need to know is that when we are getting a request from the patient's attorney, that we need to have a HIPAA valid authorization, as well as a proper subpoena to release those records. Now, if we get an attorney request from the opposing attorney, it is important that we look for the terms notice of production or HIPAA release. And this will allow your office to disclose the records without an authorization. So that's where that is. But it is best practice to contact the patient before you do this to notify them that they are releasing your medical records. So now we'll talk about the confidentiality list. So the confidentiality list is a form that we created in order to make it easier for medical records departments as well as the patients to understanding how their medical record or to whom their medical records will be released and what information will be released. So in option 1 is your all records will be disclosed. So the patient understands that whoever they put on this list is entitled to request records on their behalf and be have access to all of their medical records. Option 2 is about limited records, or more commonly a emergency contact list, where they can receive information, on a need to know basis, but it will be limited. And then option 3 is about those very specific patients that we all know of that we don't want to disclose our information to anybody, so it makes it a quick way to do that. So all of the extra wording on that form is really to make it clear so that your medical records department can release records faster, so they understand what they're doing, as well as to the patient so that they don't cause any confusion, because patient confusion is the #1 way to get a complaint. And we've even seen that unsubstantiated complaints can lead to government investigation. So we want to avoid that as much as possible. So now we can start talking about the law that has been looming over our heads for 2 years now and will actually be enforced relatively soon. So information blocking is defined as any practice that is likely to interfere with access, exchange, or use of electronic health information. So the government believes that patients having more control and more access to their medical records with technology, now that we can get everything instantly, we have to make sure that we are getting records to our patients as fast as possible, because this is being considered good health care by not only the government, but also by patients themselves. So inherently suspect activities, things that would be get you in violation of information blocking, would be interfering with patients trying to get their own records, other providers trying to get records on mutual continuity of care patients, anybody who's looking, or payers who are seeking EHI to confirm a clinical value, or anything related to patient safety and public health. So it's really about information sharing, making sure that we have expedited processes to get records to where they need to go as fast as possible. So there will be times in which we want to block access or we'll receive a request and we will not want to fulfill that request for many different reasons. So under information blocking, there are 6 different exceptions, and in the upcoming months, it'll be very important to become familiar with these different exceptions. It's important to note that these are meant to be rare. We are not supposed to be blocking the flow of information. However, if the exceptions do apply, then we should be using them. When we do want to apply an exception, say a privacy exception, because maybe we get a request from a doctor that we don't know is within continuity of care, well, then we would want to apply the privacy exception, and that would include filling out a form. And you would have to fill out a form each and every time that you would want to apply an exception. So some examples of information blocking could be taking a couple of days to deliver medical records when the practice has the capability of releasing the records the same day. So if the patient is complaining that, even if you only took 3 or 4 days to get medical records to them, they can still complain, and you would have to be able to prove or have an explanation as to why it took you not instantly, or why you didn't do it in a few hours, to making sure that you got those records out as fast as possible. Or any kind of discouragement from a patient getting their own medical records could be construed as information blocking. So we really want to highlight that information blocking and the HIPAA privacy rule are going to work in tandem when it comes to releasing medical records to our patient, and it's all in an effort to make sure that patients get their records on time, in the correct format, and at a reasonable price. So the main differences that come with releasing medical records when it comes to distinguishing between HIPAA and information blocking is the idea between permitted versus required disclosures. So as a reminder, HIPAA applies to all of the written records, and information blocking refers to all of the electronic information. So with HIPAA and a permitted disclosure, this means that you were permitted or you were allowed to get authorization from the patient, but you didn't necessarily have to. But now with information blocking and electronic information, those disclosures are now required, which means that getting authorization from the patient would be considered an unreasonable delay, and so that we would be required to share those records immediately. And as a reminder, that if you get a request for electronic health information, but you want to apply one of the previous exceptions that we talked about, then you would need to use an exception form. So we have created within our HIPAA kit, and even have released it as a separate product, is our Releasing Medical Records Kit, which has all of the forms plus more that we just went over, as well as quick guidance, quick access guidance, and as well as video training on more specifically how each form works and how to properly use them, and we believe is now a must for any medical records department. So that covers everything on my end, and so I'm going to throw it back to Michael to discuss HIPAA security. Michael, you're muted.
Oh, thank you for that, Joe. I was muted there. I was talking to you. We're going to go ahead and turn over here and move on. But kind of late breaking news that we discovered. So as Joe mentioned, some of the things that are happening with HIPAA are in the proposed rule. They told us at the end of last year in their notice of what they expect to get done this year, that the proposed rule would have been finalized and published by March. So it could actually happen any day. The proposed rule will have more changes, exactly kind of what Joe told you about, but this was something that we found in the Legal Management magazine. And so expect this to come your way. And this is attorney request. So when attorneys right now to get medical records have to have either that authorization or put on there that notice of production. But with the implementation of the new proposed rule, attorneys will be allowed to get medical records directed by the patient. So the access request where the patient is allowed to direct records will apply to for attorneys as well, which means you cannot charge attorneys your state allowable or any other rate. It must be by the new rule limited to labor only. So this attorney article basically put on there, stop using an authorization, get a patient access request. So the patient directs them over, because with an authorization, you are only permitted to disclose records. An access request now requires you by law to send those records within 30 days. When the proposed rule goes into effect, it'll be 15 days. So now if you don't get an attorney those records within, say, the 15 days, they can now turn you in for a HIPAA privacy violation. So that's going to change. The other change, that those of you that use a medical records vendor to release information, they are going to have to apply the same and only be allowed to charge an hourly labor rate. Basically, the government is saying no profiteering off of medical records. And it was almost, and it was stated, it is designed to put those people out of business, the information vendors. So that's going to be a big change that you need to get ready for. As soon as this rule is published, of course, we'll put out an email to everybody, but do understand that 60 days after it is published, it will go into being enforced. Okay, so Joe, again, I want to thank you. That was a great presentation, really kind of laid everything out. And you know, we do have the kit. We'll have a special offer if you're not our client. If you're our client, please send us an email and we'll send you the kit as part of your ongoing service. If you're not a client but would like to get all of those forms, the training and everything else required, it's got probably about 50 or 60 different forms in there that you can use to make sure that you and your practice are compliant as well. So now we want to talk about the essentials of HIPAA security. So again, it's, you know, what we want to do with this webinar is help protect your practice. So because these access complaints are the #1 enforcement, we also want you to understand that with the HIPAA essentials security, that you have to understand that the cyber criminals are out there. And it's easier than ever to be a cyber criminal. So one of the things that I want to show you is that they now have malware as a service. So if I'm a disgruntled employee and I want to get back at you, well, maybe I don't know how to do ransomware, but that disgruntled employee knows all the information to hire malware as a service. Hey, cyber criminal, I'll give you, they haven't changed the front desk username and password for the last 3 years. I'll give that to you. That'll get you in, and then I want to share with any ransomware or other profiteering you make off of that. It is that easy to have your practice go under that. You know, so again, we need to protect things, and we'll be talking about that. but you can go to this Best Hacker Tools. This is on YouTube, and it'll tell you, you know, how to get past a firewall, how to do password cracking. It's just too easy for them to do it. It's very profitable, and that's why we see continued rise. So some of the things, and again, unfortunately, healthcare breaches, even though they may affect thousands of patients, they just don't make the news, at least not the front page. You've got to look for it. But just within the last 45 days, these are some I found that have been ransomware or had their records stolen by cyber criminals. Peachtree Orthopedics, MedInformation or MedInform Systems, Mission Community Hospital. As you can see, this is going on every single day, and you and your staff have to be ready for it. We're going to talk a little bit about the security that your IT needs to put into place, but the biggest part of your security is your people and them following your policies and procedures. So now I hear this every day. I don't need to worry about security because we're cloud-based. Well, you still have a lot of security to worry about. Just recently, we've had clients get caught up in these breaches where Allscripts had a breach of their cloud EMR. Greenways had it, HIE Networks, and most recently, NextGen EMR. So you also have a lot of information on your computers, and your computers there at the office are the gateway to your cloud. So just because you're cloud-based doesn't mean you're safe. So there's no such thing as perfect security. We're not recommending that. It just doesn't exist, but we need to have reasonable and appropriate security. And that needs to be based off of a cost analysis of what is this going to cost us, not always only in money, but also in productivity. And what's the security added? And we need to come up with a good balance. But most of the HIPAA security rule is addressable. Addressable means we do this review and we have it documented somewhere. That's really what a risk analysis is about. So I've got a question for you. And unfortunately, too many offices we've gone into have answered this yes. Does your organization spend more on coffee every year than security? Not a good, even with a good Starbucks expensive coffee, you still need to spend a reasonable amount on security because you do have to aggressively protect PHI. A little paranoia, not a bad thing. So just understand there are tons and tons of threats. They're always evolving. And with good policies and procedures, good IT security, we can greatly lower our risk of being one of the practices you know, in the news. Even if it's on page 20 of the news, you're still going to be reporting it to all your patients, and you're going to lose that valuable trust. And that's kind of the biggest thing here is the trust between you and your patients, because I'm not going to tell you things that I don't want to get out if I don't feel your medical records are safe. Unfortunately, doing this for 14 years now, I can tell you the majority of medical records out there are not safe and your information is at risk. So that's why we're going to see a increased enforcement. In a way, it's a good thing because, again, medical records has so much information that can be embarrassing, that you may not want others to know, or that could lead to identity theft. So we're going to talk today about security and layers. And this is pretty much the way all of the IT companies and staff members do it out there. We have a perimeter defense, our firewall. We have an endpoint protection. That's the actual computer, laptop, desktop. We've got some new advanced layers, endpoint detection response, zero trust. I'm just going to kind of mention these. Monitoring, don't just let your network sit there. You have to know what's going on, and IT is best for that. We also, and again, number 5, policies and procedures and staff training, number 6. These are really the critical ones because most medium-sized practices and larger have all the top ones covered. But if you don't have policies and procedures and staff training covered, you're still going to be at great risk. So reasonable appropriate security measures, again, firewalls, antivirus, testing, monitoring. The new updated zero trust. If you don't know what that is, ask your IT vendors. Same thing with EDR software. MFA, we're all familiar with MFA because we all use Google in some way. And if you add a new device, not only do you have to put in a username and password, you've got to get a code. That's multi-factor authentication, highly required these days. 321 backup, we'll talk about that real quick as well. But that firewall, that is your primary protection from the outside world, and you need to have a good one. It needs to have intrusion detection and prevention. The firewall that you have from your cable vendor, nowhere near adequate enough to protect patient medical records. Here's a good example. You've got a SonicWall TZ370 for most small to medium-sized practices. That would be a perfect investment, probably cost you installed about $1,200 to $1,400. But also find out from your IT people, if they're not monitoring it, how you can pull up the dashboard of these firewalls. You can see where your staff has gone and other valuable insights into your network. If you've got staff members going to YouTube or other news sites, celebrity sites, you definitely want to be able to shut those down. Today's modern firewalls give you easy access and control over that information. Don't forget about the Wi-Fi. The biggest thing I'm going to tell you on Wi-Fi is most of the cable companies have gone to a much better secure Wi-Fi. Bigger practices will have dedicated Wi-Fi, but always change the default password. Do not let the cable guy come in, put it in, and then leave without them telling you and showing you how you can go in and change that password, because they've used a common password and everybody knows that password, so you need to make sure that that is protected. We also highly recommend that you segment your network, have a network that your information's on. Again, all of these modern firewalls can segment it at no additional cost. So we've got some for the doctors and staff, but again, if they were to go to a bad website, it can't get over to your production network. And some practices also like to have free or guest Wi-Fi. Remember that that eats up your bandwidth. So if you don't have a lot of bandwidth, you don't want to slow your whole practice down just to offer guest Wi-Fi. So do understand the pros and cons there. But separate Wi-Fi for staff and doctors, probably a very good idea. Antivirus. Antiviruses protect you from known malicious software. That's why they're updated usually sometimes multiple times per day. Windows Defender is a great antivirus, but the other ones that you can get out there, such as Malwarebytes Pro, they have much more than just antivirus. They can help block malicious websites. They do a lot more for you. It's usually a cost of $10 to $15 per computer per year. Highly recommend that you go to a better protection. Again, you've got the most valuable data that the cyber criminals are after, and typically we don't have the same protections as a bank. So you're a softer target, and we have to harden this up as much as we can, and this is an affordable means to do so. All kinds of different ones out there. I recommend you get with your IT person and let them determine what's best for you. This new what's called endpoint detection response. It's pretty new on the scene. Most of the antiviruses, you can purchase additional protection and get this EDR. What I recommend it to my clients for is that it has forensic logs. Even a small practice could easily spend $50,000 on forensics once you get infected. The bigger practices, I know some practices that have spent $150,000 just having $500 an hour forensic IT come in, determine what happened, where it happened, how it happened, and what it did once it got onto your system. This EDR keeps all those forensic logs and it can print them out immediately. So it is great protection from any type of breach. It also is layer 3. It sits behind the firewall, the perimeter, sits behind the antivirus, the endpoint, and it searches for things that happen that may get beyond those two layers. Zero Trust is another upcoming cybersecurity tool. And basically on your network, you have a trusted network. I can go from one computer to another computer through the network easily. A Zero Trust model says, nope, I don't care that you're on the same network I'm on. you've got to present me with the proper credentials or you can't get over to this other computer. So it can really slow down the cyber criminals activity, give you time to detect it and stop an attack. So highly recommend you look into that as well. Of course, getting IT managed services, it can be very expensive. I know practice or IT that charges between $30 and I know IT that charges $100 per computer per month. I would tell you, even as a small practice, I know it sounds radically expensive, but the cost of a breach is so overwhelming, and especially with the reputational damage it can cause, you need to look into these different things. And again, from a HIPAA security rule, at least evaluate them. So I would have a managed services agreement or proposal, whether I go with them or not, just to show that we did that. So policies and procedures, again, your employees are your biggest threat. So we definitely want to make sure that we are properly addressing that threat. Identity management, talk to your IT person about using hardware or software that helps you double check a person's credentials. Cyber criminals compromise credentials and identity management can help to alleviate that threat. Inventory management, I've got on the screen for you. This is what the government expects you to have on each piece of equipment. Remember, there's a 6-year retention for all HIPAA documentation. And with this inventory, you should also have a certificate of destruction. Backups, incredibly important, especially with cybercrime rising. You need to have a good backup, and we recommend what is now called 3-2-1. 3 copies of the data, 2 different media sources, 1 copy off-site, and ask IT, is it an immutable backup copy? So even if the cyber criminals get to it, this is a backup copy that cannot be changed. I do know of practices that have had their practice saved because they had that immutable backup copy, and even though the cyber criminals destroyed the other backups, they had a copy that was only a week old, so they lost all their data for the last week, but they were able to get back up and running in a quick manner. And that's a big part of your contingency and backup plan, is getting back up. To tell you how prevalent this is, the doctor that I went to last week to see for personal reasons, they were running an hour late. This is an office that I had never waited more than 2 minutes to see the doctor. They run that on time. They were an hour late, and I got back there and I asked the nurse that I knew, and she goes, "Oh, we got hit by ransomware this morning." And they were able to get hit by ransomware first thing in the morning, and they were back online by 1 o'clock that afternoon. That is good IT, and that is really what you should be striving for as well. Patching, this is a part of making sure that our computers are up to date with security updates for all the software. So that's why we can't use Windows 7, we can't use Windows XP. They work great, but they are not patchable, which means they can't be updated, and therefore they are a huge security risk. So you can either perform patching by IT, automatic, or software patching. Vulnerability scanning will also be something that your IT person can have and run a scan and tell them what software needs to be patched and which ones are the most critical to be patched. We always want to do encryption. Encryption is a safe harbor. Encryption is a special method of locking files, and we need to make sure that all files at rest and all files in transit are at least evaluated for encryption and where we can. Now, it's not always possible to encrypt everything, but what we can, we definitely need to do, and we need to document that in our risk analysis. Remote access, connecting to public Wi-Fi is a definite no. Not Starbucks, not at hotels. Hotels, they give you that nice little card. It says, here's the Wi-Fi password. Well, it's the same one for everybody, so that is not a secure. Use your personal hotspot, and where possible, use secure VPN, virtual private network software. Be careful. I just saw that 2 of the most commonly used free VPNs were hacked, and a lot of data was stolen from them. So use a reputable one set up by your IT. Cell phones and tablets, if you use them in your office in any way, shape, or form to get patient information, texting, even if it's just with a code, emails that have patient information, make sure they read and sign your mobile device policy, which gives them the instructions on using a 6-digit PIN or biometric, deleting text messages with PHI when they're no longer needed, and maintaining physical access and control over that device. Now, disgruntled employees are a huge danger, and not having your USB drives locked down for mass storage devices really puts you in a bad situation, because if I know I'm about to get fired and a lot of employees know it's coming, I can just plug in my USB drive, which is a security violation just in it of itself, because it could have malicious software. But now they can just sit there and download as many patient records as they want. And if we're not properly monitoring, we won't know until we get the phone call. So we definitely want to make sure that IT comes in and disables the use of USB ports for mass storage. They can still be used for printers and other purposes, but it will keep people from downloading PHI onto thumb drives. Administrative privileges. Review your administrative accounts. Who has administrative access? Scan your system for old accounts that are no longer in use, and work with the vendors, because some of your EMRs require that everybody have administrator access. That is extremely dangerous, because once a criminal compromises those credentials, they've got the keys to the castle. Remote access, protect your RDP or your remote desktop ports. They are the most common source of intrusion by cyber criminals. So make sure that they get locked down, limit your remote access to only those that need it, and monitor it. And that comes to our system activity review. You need to be monitoring your employees, monitoring all vendor access, and you need to ask IT what logs do they monitor for you. And HIPAA's not done if it's not documented, so you definitely want to get those documented. Email, dangers all around. Still the #1 source of ransomware is that they are getting into your accessing email and or sending an attachment with a link, and your staff clicks on it, and now they've downloaded malicious software. Spam filtering, talk to your IT guy about using software to filter out a lot of those bad emails. And always have your risk assessment done. So we call it a risk assessment, but it's actually a risk analysis and a risk management plan. You have to have that yearly for HIPAA. The fine for not doing a risk analysis is $1,000 per day, and they can go back as much as 6 years. So it is the most common reason for multi-million-dollar fines, is that the organization did not have a risk analysis in place. Okay. Remember that if you have on-site server or backup, it may be worth it to get a cage that locks that thing up. Because again, if I've got a server and somebody steals that, that could be $1 million exposure. So is it worth a $355 cage bolted to the floor to give it additional protection? In many cases, the answer is yes. Okay. Hardening, again, that's something to go over with your IT, but we definitely want to make sure that software patches are applied. That's part of it. Passwords, and that we have good network access protected by a strong password that nobody knows but us. You have to break that break and fix mentality, that we're only going to call the IT guy when we need him. We need him monthly, quarterly, biannually to come in and harden our systems. That is being proactive, and for these costs, you can definitely reap the rewards. Okay, just to give you an idea, this would be estimated basic cost for a brand new practice, having to buy a good firewall and putting all this other stuff on. The cost after this, so the firewall would go down from like $2,000 to about $400 to update the software yearly, but you can see it's not unreasonable cost to provide good and proper protection. Of course, it can and will go much higher than this with the new protections. But again, the software or the cyber criminals are upping their game. You need to stay up to date with them. Budgeting is a requirement. So security is an ongoing war. But unlike in war, if you lose one battle, you could lose everything. And again, the most important is your reputation and that patient's trust. Okay, I'm gonna put off questions here for another minute so I can do this. So it looks like we're gonna run right till noon. But I do wanna finish the last of our slides so that we can do that. And then if anybody wants to stay over, we will stay over and answer questions, or you can always email them to us and I'll give you those email addresses here at the end. But how do you prepare? How do you get ready? Well, one, you have to access and evaluate your fees charged for medical records. So especially with the proposed rule coming up, how much does it cost you per hour to do your medical records? You need to do that and evaluate what charges you're going to charge to patients and what charges for those that we have to give other access to. So from your medical records department, we need to do, and we have now added to our risk analysis, a detailed analysis, not only of the fees for medical records, but also your response capabilities. Remember that a patient can make an information blocking complaint because they thought you could get the records done for them that day, and you took 2 days to deliver those records. And when that OIG auditor calls, or the Office for Civil Rights, who can also enforce information blocking, I want to be able to show, here's our response times. Here's what we have. Here's our average intake. Here's how much staff we have. Here's how we get this done. So most of our requests are out in 3 days. We got theirs out in 2 days. So we were not information blocking. That could be extremely valuable information, and why we have exclusively added it to our risk analysis to make sure that you have that documentation when it's needed, not trying to develop it afterwards. You need to look at your policies and procedures, looking for any unreasonable delays. So if you have HIPAA policies and procedures for medical records release that have not been updated for the access guidance, you are an information blocker. Just those policies alone could land you huge fines, and don't forget Medicare and Medicaid fraud charges as well. So information blocking, I cannot overemphasize how much to take it seriously. As Joe said, they're in the final stages of releasing the enforcement rule. Once it gets published, 60 days afterwards, they could be coming after you, and I expect them to, because you've had since April 5th of 2001 to be ready for this. Also, make sure that your business associate agreements and any other written service contracts do not have any delays. You cannot have that it's going to take 5 days or they have up to 5 days. It has to be the phrase immediately or within a reasonable time frame. Update your HIPAA risk assessment yearly. Again, every year for the past 5 years, there have been major changes. This year, the biggest change is we are going to evaluate your medical records department and give you the documentation to show that you are not an information blocker. Also, and we don't fully understand how they're going to do this, but the new proposed HIPAA rule says that patients have the right to ask, and other continuity of care providers have the right to ask for stat reports, and you must prioritize those. So we're going to have to determine in your policies and procedures how that is going to be done as well. Okay, we're right at noon according to my clock. And so I want to thank all of you for your time and attention today, let you know that we are here to help. For attending our webinar today, if you go to our website, HIPAAcompliancekit.com, go to the pricing page, you can order our medical records releasing package and get it $50 off by using webinar 50 as the code. If you are our client and attending today, please send us an email and we will get you that updated package out today so that you've got those forms to review and go over. We highly recommend, we're going to make this webinar available, and for at least Joe's portion, make sure that your medical records department watches that, or we have a separate, on that package, we have a separate training video there as well. So please feel free. I've got Joe's email down here, McCoy J. I've got the wrong email.
That'll work.
That'll work. Okay, that'll work. So let me see if I can get back to that slide. I don't think I can here. Oh, here we go. So we also have, and I'll just add it here real quickly for those that are still on.
No, it's just JM.
Oh, sorry. Okay, so again, I want to thank you and remind you, please send an email. You can either send it to either of these emails or my email that I put up earlier, and we will get you out your CEU credit as quickly as we can. We should try to get most of them out today, if not tomorrow.